Hello, I'm Dr. Kimberly DeQuattro, and I'm a rheumatologist at UCSF and Highland Hospital in Northern California. I've been asked to share important findings about lupus in patients of Asian ancestry from the US-based California Lupus Epidemiology Study, also known as CLUES. Lupus is a chronic multisystem condition that affects all individuals. However, there are disproportionate effects on patients of racial, ethnic minority backgrounds. In the past several decades, research has shown that individuals with African and Hispanic ancestry experience worse lupus disease outcomes. International studies have also suggested worse outcomes for Asian patients. We studied how lupus affects those with Asian ancestry living in the United States to identify areas that need more focus. We looked at lupus disease activity, a measure of how controlled someone's disease is at present, lupus damage, a cumulative measure of organs permanently affected by lupus, and lupus severity, a measure of future risk for morbidity and mortality. Morbidity is a long-term complication of a disease that can affect quality of life, and mortality is a risk of death from a disease. CLUES is an ongoing longitudinal study supported by the Center for Disease Control that started in 2015 to understand outcomes in patients with lupus. At the time of this study, 328 participants were from the San Francisco Bay Area and represented diverse racial and ethnic backgrounds. People of Asian descent were the most common racial ethnic group at greater than 35%. This allowed us to study features of lupus that are especially important for this group of patients. The two most represented Asian subgroups were Chinese and Filipino, the first and third largest Asian subgroups in the United States. Of the main racial ethnic categories, Asian and Hispanic patients were the youngest at the time of the study at 41 years old and had younger age of diagnosis at 28 years old. Of Asian subgroups, Filipino patients were the youngest at 37 years with an age at diagnosis of 22 years. To assess the three lupus measures, we accounted for age at diagnosis, gender, and educational attainment. Lupus disease activity was low and not different among racial ethnic groups. For lupus damage, Asians were similar to Hispanic and white individuals. Lupus severity was significantly higher in Asians as compared to white individuals, but not individuals of African or Hispanic descent. We also found younger age at lupus diagnosis was associated with higher damage scores among Asians, and this pattern was also true for individuals of African and Hispanic descent, but not white individuals. What we learned in CLUES parallels other studies in individuals with lupus of Asian descent outside the United States, that Asians experience an earlier age at diagnosis of lupus and greater lupus severity than white individuals. Biological, genetic, and environmental factors could explain these findings. What does this mean for patients and their families? Know that symptoms of lupus can start in the late 20s or even earlier for Filipino individuals. Be aware of mild to moderate lupus symptoms such as patchy hair loss, rashes to the face, chest, and arms, ulcers in the nose and mouth, color changes to the fingers, joint pain, and joint swelling. Severe features of lupus include kidney and brain involvement. Kidney injury may associate with leg swelling, frothy urine, or high blood pressure, leading to headaches or vision changes. Brain involvement might present as weakness or seizures. Please share these symptoms with doctors and members of the healthcare team without delay, since early diagnosis and treatment can help prevent long-term negative effects of lupus. We want to thank patients for their participation and commitment to studies like CLUES. Each person's experience is critical to help unravel the mysteries of lupus and reveal how it affects groups differently. This knowledge helps doctors and healthcare teams provide more targeted information, prevention, and treatments for diverse patients with lupus. Thank you so much.